Zoonotic diseases are infections transmitted between animals and humans and can be bacterial, fungal, viral, or parasitic. People can get infected through direct contact, consumption of contaminated food or water, bites from infected vectors, or exposure to contaminated environment. Hello and welcome back to Vet Talk. I'm your host Akma and this is our moderator Grace.
Hi, I'm Grace.
In today's episode, we are diving into a hot topic which is zoonotic disease and the critical role of veterinary medicine to keep pandemic at bay. Today, I'm so excited to introduce you guys these 5 awesome guests. We have Dr. Anis and Dr. Afika representing scientific side, and Dr. Hadnis who brings ethical insights. Dr. Alia discuss the impact on economic, and Dr. Paul sharing perspective societal.
Thanks, Ika, and welcome everyone. Before we get started, let's get on the same page. Zoonotic diseases, also known as zoonosis, are infections that jump from animals to human. And when one of these spread worldwide, it becomes a pandemic. We have all seen the example of COVID-19 and bird flu. Today, we are exploring the key challenges and solutions from multiple angles with an incredible panel of experts. Dr. Anis, as we all know, zoonotic diseases pose a huge public health risk because they can lead to outbreaks and pandemics. What is the biggest challenge you face as a zoonotic disease researcher?
I would say one of the biggest challenges is rapid mutation of pathogens. Based on my case study about SARS-CoV-2 and its variant COVID-19 was first detected in late 2019, but in between 2 years, multiple variants emerged to Alpha and Beta along with Delta and Omicron prolonged the pandemic. The unpredictability mutation of pathogens is become harder to develop long-term solution and updated vaccines.
That's really concerning. Any solution has your team tried to prevent zoonosis pandemics?
Absolutely, we are investing in zoonotic viruses research and developing better vaccines. With continuous studies, we hope we can develop early detection methods and develop better vaccine with fewer side effects. This will help us early detection and prevent the outbreak from becoming pandemic.
That is fascinating. Precise early detection procedures and better vaccine development is crucial in both preventing and protection of global health.
Okay, Dr. Hanis, what actions should be taken to prevent and manage zoonosis pandemics effectively?
Okay, thank you for the question, Grace. Okay, to prevent and manage zoonosis pandemics, I will suggest establishing investigative and also legislative groups so that these groups can monitor disease outbreaks, develop policies, and also ensure proper regulations for handling animals and food safety.
Collaboration between governments, health organizations, and veterinary professionals is vital to upgrade our civil system and early interventions efforts.
Now, moving on to the economic impacts of zoonotic diseases and global health. Dr. Alia, one primary concern is the high cost of imported vaccines and treatments. What can be done to make this more affordable?
That's a significant challenge. One effective solution is to manufacture vaccines locally. This will reduce production and transportation costs, making them more affordable and accessible for farmers and pet owners. On top of that, government should allocate at least 5% of their health budget to veterinary services.
Very practical approaches. Animal health is often overlooked, yet it directly impacts to food security, livelihood, and even human health through zoonotic diseases. Investing in local vaccine production and increasing veterinary health funding could help prevent outbreaks and protect both animals and human populations. Dr. Paul, in your opinion, why veterinary medicine is so important in global health?
It's a good question.
You know, around 75% of infectious diseases in humans come from animals. Veterinary medicine helps detect and control these diseases before they spread to humans.
I see. I've heard of the One Health approach. How does it fit in?
One Health connects humans, animals, and environmental health. When we destroy the animals' habitats or engage in wildlife trade, we increase the chances of new diseases jumping to humans. In this case, veterinarians help regulate this area to reduce pandemic risks.
What about major outbreaks like COVID-19?
Diseases like COVID-19, SARS, Nipah viruses originated in animals. Veterinarians work with public health officers to track these viruses, identify risks, and develop strategies to prevent human infections.
Alright, before we end, any last word to say in this discussion?
Yes, we're still facing the challenge of lack of global coordination in surveillance and response. Early warning about COVID-19 were delayed, and not all countries act fast enough to contain its spread. There was a limited sharing virus data, make it harder for researchers to track the origin of SARS-CoV-2 and develop countermeasures.
Absolutely, fighting zoonotic disease isn't just the job of one group. Scientists, veterinarians, medical doctors, or even the public have their own role to play. We need better surveillance, more funding for research, and strong global cooperation to stop the next pandemic before it even starts.
Coordination is a big challenge where veterinary and human health sector often work separately. More collaboration, funding, and surveillance are needed to strengthen pandemic prevention.
That's so true, Dr. Alia. My point is public awareness is key. People need to understand the importance of hygiene and also self-handling animals. Simple practices like washing hands after contact with animals, properly cooking meat, and also avoiding contact with sick animals can greatly reduce transmission risk.
In my opinion, veterinarians plays a crucial role in monitoring animals' population for early signs of outbreaks. For example, detecting avian influenza in birds allows us to take action before it spreads to humans. Besides that, they also involve in vaccination programs like rabies control and ensure food safety in preventing infections in food chain.
In short, veterinary medicine isn't just about animals, it's also a key part of protecting human health.
Exactly. Investing in veterinary medicine is one of the best ways to prevent the next pandemic.
Thanks for everyone's insights.
Thank you for having us.
When one of these diseases spread globally, it becomes zoonotic pandemic. Think of imaging of COVID-19 or even H1N1. It is swine flu. Both of us remind how connected our health is. When COVID-19 spread gradually, our veterinarian experts contribute in both research and study about what is the cause or even what is the animal that caused the virus happening. That is proven that veterinarian medical is vital to improve or to maintain our global health.
Thank you for listening to our podcast. Take care and stay focused on the latest issue of global health. Bye!